Good morning, guys. Today I'm going to deal about critical care unit. So, what is a critical care unit? Is a specially designed and equipment facility staffed and a skilled person to provide effective and safe care of dependent patient with life-threatening problem. So, critical care nursing means specialized within the nursing deals and especially with human response to life threatening problems. So the who will be handling only licensed professional nurse only they can handle. They are the responsible of acutely and critical ill patient through and their families optimal care. Okay, so 7 cs of critical care. So 7 step is that. So compassion, communication, consideration, comfort, carefulness, consistency, and closures. So communication with the patient and families. Consideration means patient, relatives, colleagues. Then avoid the conflicts. Then carefulness means avoidance of injuries. Closure means ethics and withdrawal of the care. So types of ICU means on open, on closed. So open means physician admit and treat and discharge. So closed means admission and discharge and referral policy to under the control internist. Then ICU level 1. Level 1 their high dependency and close monitoring, resuscitation, short-term ventilation will provide for less than 24 hours only. The percent ratio 1:3. The medical staff is not present until the on the time. Okay, so level 2 means provide observations, then monitoring on long-term ventilation with resistant doctor, the nurse and patient ratio 1:2. So junior medical staff available anytime, then consult the medical staff also available needed. Level 3 means located in major tertiary hospital to which is referral hospital should be provide intensive care, require dialysis and cath lab and service, etc. So types of critical care unit means neonatal, pediatric 1 month to 14 years, psychiatric, then coronary care unit, cardio surgery intensive care unit, cardiovascular intensive care unit, medical intensive care unit, medical surgical intensive care unit, then neurosurgical intensive care unit and burn intensive care unit, surgical intensive care unit, trauma intensive care unit, respiratory intensive care unit, and geriatric intensive care unit. So you can working in multi-specialty hospital, you can see that one. So what is the principles? Okay, first one is anticipation. So anticipation is the recognize the high risk patient to requirement, then prepare for meet any emergency, properly harness which necessary equipments with the supplies. So that is cause it's a properly harness which is necessary equipment and supplies is mandatory and smooth running the unit. Then yearly detection and promote the action. So yearly detection of variation to promote appropriate action, otherwise prevent. Then example cardiac monitor function, that is important assessment. Then collaborative practice. So collaborative practice is a partnership designs making the ensure the quality and compassionate the patient care. So example CPR. Okay, then communication, interpersonal and interdepartmental and interpersonal communication is the must want to correlate with the unit. Okay, so it's a clinical decision making. Use the integrate of the medical disorder and join the review of care. So prevention of infection. So nosocomial infection is the lot of in the healthcare service. It's a critical health patient required to intensive care to greater risk for the immunocompressor with antibiotic usage with under stress. So mechanical ventilator, prolonged stay patient and all nosocomial infection they will affect. Then crisis of intervention and stress reductions. So partnerships are formed during crisis, bonds with between the nurses and patient family strong during the hospitalization. So the patient advocate nurses assess the patient to express fear and confusions and identify the cravings of the pattern and provide the avenue of the positive copings. Then staffing, medical staff or nursing staff. Medical staff means senior medical staff. Their appointment to the ICU. It's a there will be director to the all the nurses Example, anesthesia, medicine, then just everything they will come. And the nursing staff, nursing are the major teaching to the traitree to train will require for trainer nurses in critical care unit. There is a 1:1 ratio they can use. Okay. Then other responsible means pharmacist, physical therapist, then occupational therapist, advanced practice nurses, and physician assistants, dietaries, and biomedical engineers. So physiotherapist to prevent the treat and chest problems, to assess the immobilization, prevent the contracture or immobilization patients. Pharmacist means the potential drug interaction and side effect, and losing the patient with renal or dysfunctions. So dietitian advance the nutrition requirements of feed the patients. Okay. Then microbiologist means treat the infection control. Then medical physics technician means maintain the equipment and patient monitor, ventilator, humidifier machines, and blood gas analysis. Then responsible of the critical care nurse. So continuous monitoring, keep ready emergency trolley, cross cart, then individualized care, then counseling the information to the family, application of the policies and procedure, proper documentation for the all the activities, follow the infection control principle, keep update with the advanced informations. So quick reference of protocol to managing emergency. Quick review patient means identify history, physical exam, be with the patient, ask for help, place the patient to suitable position, attach the cardiac monitor to call or crash cut, monitor the ABC along with the expert, introduce the IV CV line to then administer the medical as needed, carrying the investigation ABG, EG, RFT, LFT, and all those. Then careful monitor the hemodynamic status, monitor the fluid intake and electrolyte means record the right things and write them rightly. Then critical careness factors means interpersonal factors, technical qualification, then education background, clinical experience. So then sorry, two slide there. Then organization of the models. What are the organizations? A open model means many different members of the medical staff to manage the patient with ICU. Closed model means limited ICU certificate, physician managing all the patients. Hybrid model means it's open or closed model of by stopping ICU, attending the physician, and teamwork to primary physician. Definition of the intensive care equipment means intensive care equipment to patient monitor, respiratory, cardiac support, pain management, emergency resistance of devices, other life support equipment designed to the care of the patients who seriously injured via critically life-threatening illness have to undergo major surgical procedure. They requiring for 24 hours care of monitoring. Description. Intensive care unit on the patient, especially description to the patient monitoring, life support, emergency resuscitation device, diagnosis device. Then patient monitor means acute physiologic monitoring system, pulse oximeter, intracranial pressure monitor, apnea monitor. Then here life support resuscitation equipment means ventilator and infusion pump, crash cot, and intra-aortic balloon pump. Then diagnostic equipment mobile X-rays, portable clinical lab device, and blood analysis. So this is the normally using for critical care nursing management for the ICU nurse role.